Have you been told to avoid seeds, nuts, or corn because of diverticulitis? That advice has been around for decades, but recent research tells a different story. Today, we're going to break down what diverticulosis and diverticulitis really are, why the old seed theory stuck around for so long, what functional medicine has to say about diverticulitis prevention, and finally, I'll share a brand new study that turns conventional wisdom on its head. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. So let's start with the basics. Diverticulosis is a condition where small pouches called diverticula form in the wall of the colon, and these are usually caused by increased pressure inside the colon, especially in the areas that are naturally weaker. Most people with diverticulosis have no symptoms at all, and it's often found incidentally during colonoscopies and less so during imaging studies. But sometimes those pouches can become inflamed or infected, and that's when we call it diverticulitis. And symptoms can include abdominal pain, fever, chills, constipation, or diarrhea. And in some cases, they can lead to complications like abscesses and or perforations. And it's this condition that can become so serious so quickly that it often requires antibiotics or even surgery. And as a surgeon who's been operating on this perforated colon and removing the diseased perforated segment of the colon, it always strikes me on how devastating diverticulitis can actually become. Often during this emergent surgery, a colostomy or a stool bag is made, and because abdomen is too contaminated to put the colon back together during the same surgery. And at those times, I think about prevention, and that's where functional medicine comes in, but we'll talk about it in a few minutes. First, let's look what used to be the conventional medicine view of what is causing diverticulitis. For years, maybe even decades, patients were told to avoid nuts, seeds, popcorn, and corn because it was believed that these small particles could get stuck in the diverticula and cause an infection. And actually, that logic sounded reasonable. But here's the problem. There was never strong scientific evidence to support that advice. And it is funny that this theory was so deeply ingrained that I remember we used to have these handouts with specific advice to stay away from seeds in general and seeds in tomatoes, strawberries, etc. And that theory was based on assumption, not data. In contrast, in functional medicine, we have a different approach. We ask deeper questions like, what is the root cause of a given medical disease? In the case of diverticulitis, the question is, why is colon under pressure? And what makes these diverticuli? What's happening in the gut environment in general that leads to inflammation in the first place? From the lens of functional medicine, diverticulitis is not just about food getting stuck. That's too simplistic. It's about gut function, microbiome health, immune balance, and inflammation. And one of the biggest players in all of this is fiber. Fiber lowers pressure in the colon, keeps things moving, and feeds the good gut bacteria that reduce inflammation and help maintain the integrity of the gut lining. And that's why, instead of eliminating seeds and nuts, we often encourage them along with fruit, vegetables, and legumes as a part of this anti-inflammatory fiber-rich diet. Thankfully, now we see conventional and functional medicine views merge. Let's take a look at this newest research, just published in the Annals of Internal Medicine. The link is included. It challenges the old narrative in a powerful way. This is a large study, a large prospective study, 29,916 women, ages 35 to 74, have been monitored for 14 years. They were healthy with no diverticulitis, no IBD, no cancer in the beginning. Dietary intake was tracked using detailed food frequency questionnaires, especially focusing on nuts, seeds, corn, and fruits with edible seeds. During that study, 1,531 women developed diverticulitis. But here's the key finding. No increased risk was found from eating peanuts, tree nuts, seeds, or foods with seeds. In fact, women who ate the most corn had a 14% lower risk. Those who followed high-quality diets like DASH, for example, they had up to 23% lower risk. And there was no link between any of these foods and the development of diverticulosis either. This study matters. It challenges the outdated fear of food particles to switching the focus to what really matters: diverse, balanced, anti-inflammatory diet that supports our gut. So if you've been avoiding seeds or corn because of an old advice, this is your permission to rethink that. Let's stop fearing food and start supporting the gut as a whole system. If you've enjoyed this video, don't forget to like, share, and subscribe for more science-backed health tips. I'm looking forward to reading your comments. Thank you so much for watching. Until next time. Bye-bye.